How do you know your dream job is actually your dream job? Many people spend their whole academic career trying to figure out that very question. Some people switch from major to major, uncertain of their future's path. Some, even happy within their major, find choosing a career path is still too broad to decide. Finding the perfect match is difficult for anyone. And without personal experience within your career, or somebody to tell you the utter truth about your job, you tend to enter your profession blind. Fortunately, I'm good friends with a cardiac nurse, Meredith Rosen, who works at Moses Cone Hospital on their cardiac telemetry floor, and she's allowed me to interview her about her career. This is her 4th year of working with the hospital, and she can personally answer questions regarding her experience to better describe the job. As we're all college students, finding a job after college is nerve-wracking. I'm hoping with my speech to better inform you about the working conditions of a nurse, and if that's not your intended field, to help guide you with questions to ask potential employers. My speech will address concepts that everyone should think about before they pick a career. Questions referring to not only what a job can do for you financially, but how a job can form you into the person you want to be and lead you into self-actualization. The main idea of this speech is what it's really like to be a cardiac nurse. While implementing Maslow's hierarchy of needs, I'm going to inform you about cardiac nursing and how it will affect your physiological, psychological, and self-fulfillment needs. First, I'll describe to you a typical day as a nurse. A typical day begins when you clock in. Your shift generally lasts 12 hours. You're assigned a group of patients. You analyze their patient records and figure out why they're there and what they're being treated for. You then use their records and plan out your day accordingly. Certain patients need medications at certain times, so you plan your day around the given task. Typical tasks include giving medicine, assessing the patient, listening to their lungs, heart, and educating the patients. Everybody has basic physiological needs they must tend to in order to survive. Food, water, shelter, and rest are all things our body needs in order to function. As a nurse, all physiological needs are met. The salary is more than substantial enough to provide food and shelter. Another basic need is security. As Meredith stated, nursing has a very good job security because hospitals are usually understaffed. The main concern in this occupation is sleep. Shifts are 12 hours long, and you only have one 30-minute lunch break, which can wear on you sometimes. But on the other hand, you only work 3 days a week, so you have plenty of time to recover. Once you feel safe and secure with your basic needs, you're then motivated to pursue psychological needs, which include your relationships, both intimate and friendly, and then your esteem needs. Being a nurse allows you plenty of time to have relationships. At work, you often lean on your coworkers and develop relationships with them. Meredith told me that many of her coworkers are her friends and that she hangs out with outside the work as well. You can love doing your job anywhere, but it's the people you work with that makes your experience unique and worthwhile. Being a nurse is sometimes emotionally taxing, so having people to talk to is very important. With the hours you work, you have time to spend with your family, friends, and pursue intimate relationships. As a part of our psychological needs, we need to fulfill our esteem needs, which includes feeling of accomplishments and your status and rank. Reiterating that into nursing, you interact with your patients more than anyone else in the hospital. And the gratitude you get from your patients when they're better is all the worthwhile. Your status and rank in the hospital is well respected because in this job you're expected to work as a team with all other staff members. Everyone is heard and everyone is listened to. And if you have a suggestion to make something better, they have weekly board meetings you can propose your ideas to. Now that our psychological needs are met, we're motivated to pursue self-actualization. According to the Huffington Post, self-actualization is when you maximize your potential and are doing the best that you're capable of doing. When you reach this level in your life, everyone's idea of fulfillment is different. At the workplace in this field, you're always capable of moving up. The clinical ladder allows you to keep getting new certifications and continue to build on your skills. And the hospital will pay for it. Then there's always a fulfillment of activities and creativity that we aspire for. The ability to fulfill other activities and life experiences is a very reachable goal, and with the hours and the vacation time given, you have the time and financial stability to travel, see the world, and do things you enjoy doing. Maslow's hierarchy of needs requires you to start from the bottom and then continue to motivate yourself to do and have more. From the lower order needs of providing food and shelter for yourself to the higher order needs of fulfilling your dreams. In conclusion, being a cardiac nurse provides a financial stability that allows you to provide themselves the basic physiological needs to live. Besides the occasional loss of sleep, all the lower order needs are fulfilled by this occupation. According to Meredith, the biggest toll in having this job is dealing with the emotional stresses. But with family, friends, and coworkers to talk to, it's easier to get through. With the hours and days you work, you have plenty of time to pursue other interests and fulfill your life dreams and goals as you further into your career. I hope you have a better understanding of what it's like to be a cardiac nurse and how you can reach self-fulfillment within this career.